Every single week in my clinic, I sit across from active, smart seniors who tell me the exact same thing. Dr. Carl, I thought waking up 3 times a night to pee was just what happens when you get older. Or they tell me, my doctor said my urine looked fine on the dipstick, so my bladder must be healthy. I am here to tell you that those two assumptions are sending thousands of vibrant older Americans into emergency rooms with silent kidney damage, undetected bladder issues, and avoidable infections. Most people over 60 think a standard annual physical with a routine urinalysis covers their bladder health. It does not. A standard urine dipstick misses the single most dangerous bladder problem facing seniors today, a bladder that isn't emptying properly and is quietly building up dangerous pressure. I am Dr. Carl. I've spent 16 years as a practicing urologist, treating thousands of men and women after 60. Today, I am going to walk you through the 7 critical bladder signs and tests every senior needs to understand, including the one simple 30-second bladder exam that almost no primary care doctor performs, but every senior should actively ask for. Pay very close attention to number 5 on our list because that single 30-second test saved one of my patients from permanent kidney failure on a routine Tuesday afternoon. Before we dive into the first point, I want to ask you a quick question. Drop a comment right down below and tell me, how many times do you currently get up during the night to use the bathroom, and what city are you watching from? I read every single comment, and your answers directly shape the topics I cover in these videos. Let's talk about the first big issue, waking up multiple times every night to urinate, what we call nocturia. Many people assume this is just an annoying part of getting older, like gray hair or stiff knees. But when you get up 2, 3, or 4 times a night, your body never reaches the deep, restorative sleep necessary to clean out brain toxins and regulate your blood pressure. In the medical world, research published in the Journal of Urology shows that severe nighttime urination in older adults significantly increases the risk of nighttime falls and fractures. What is actually happening in your body is that as we age, our pituitary gland produces less of an antidiuretic hormone at night, meaning your kidneys produce a higher volume of dilute urine while you sleep. On top of that, your bladder wall can become less elastic, holding less volume. If you are waking up more than once a night, here is your action step for this week. Keep a simple 2-day fluid journal. Write down what you drink, when you drink it, and every time you use the bathroom. If you notice you are drinking fluids like tea or water after 7 in the evening, cutting those off 2 hours before bed is an easy fix. If you take a water pill or diuretic for blood pressure, talk to your doctor about moving that dose to earlier in the afternoon so it finishes working before you turn off the lights. That brings us to item number 2, microscopic blood in the urine, or microscopic hematuria. This is when your urine looks completely clear to the naked eye. You don't see any pink or red in the toilet bowl, but under a microscope, red blood cells are hiding in plain sight. Research from the American Urological Association shows that microscopic blood in the urine of adults over 60 carries a significantly higher chance of underlying bladder or kidney issues than it does in younger folks. What happens in the body is that tiny blood vessels in the bladder lining or kidney tissue can leak microscopic cells due to inflammation, bladder stones, or early tissue changes. Because it doesn't hurt and you can't see it, it goes entirely unnoticed unless your doctor orders a formal microscopic lab check. The action step here is simple. At your next annual physical, do not settle for just a quick plastic dipstick test in the hallway. Ask your doctor specifically for a formal microscopic urinalysis sent to a laboratory. If red blood cells show up, do not panic, but do ask for a referral to a urologist for a proper look. Our third topic is sudden, overwhelming urinary urgency. That sudden feeling that you have to go right now or you won't make it to the bathroom in time. Many seniors start rearranging their lives around this urgency. They stop taking long road trips, they panic on the golf course, or they sit near the aisle at the theater. This is often labeled as an overactive bladder, where the bladder muscle spasms unexpectedly. But what many people don't realize is that these spasms are frequently caused by the bladder working overtime to push urine past an obstruction, like an enlarged prostate in men or a prolapsed bladder in women. the bladder muscle gets thicker, irritable, and starts squeezing even when it's only a quarter full. Your concrete action step this week is to practice timed voiding and pelvic floor stabilizing. Instead of running to the bathroom the second you feel a twitch, sit down, take 3 deep belly breaths, squeeze your pelvic floor muscles briefly, and let the initial wave of nerve urgency pass before walking calmly to the restroom. If this urge comes on suddenly, alongside pain or burning, make sure to get tested for a urinary tract infection before starting any long-term medications. Item number 4 on our list is a weak or lingering urine stream. You might notice it takes longer to start peeing, or the flow stutters and trickles off at the end. In everyday terms, think of your bladder like a water balloon and your urethra like a garden hose. If someone steps on the hose, or if the hose gets kinked, the water balloon has to squeeze much harder to empty. Over years, that constant straining tires out the bladder muscle, leading to what we call bladder fatigue. A review from the Mayo Clinic highlights that chronic outflow obstruction left untreated can lead to permanent stretching of the bladder muscle, meaning it loses its ability to contract entirely. If you find yourself pushing or straining with your stomach muscles to empty your bladder, that is a warning sign. Your action step is to stop pushing, let the bladder squeeze on its own, and schedule a conversation with your healthcare provider to evaluate your bladder outlet. Never ignore a stream that has noticeably slowed down over a 6-month period. Now, let's talk about item number 5, the one test every senior should ask for, known as the Post-Void Residual Ultrasound, or PVR scan. This is the absolute center of today's video. A post-void residual scan is a quick, completely painless ultrasound performed right on top of your lower belly immediately after you finish peeing in the clinic. It takes less than 30 seconds, involves 0 needles, 0 pain, and 0 radiation. What it measures is simple yet profound. It tells your doctor exactly how many ounces or milliliters of urine are left sitting in your bladder after you think you've completely finished. Healthy bladders empty almost entirely, leaving less than 50 milliliters behind. But in many seniors, due to quiet muscle weakness or subtle blockages, the bladder might leave behind 200, 300, or even 500 milliliters of stagnant urine without causing a single bit of pain, discomfort. That leftover urine sits there like a stagnant pond, breeding bacteria that cause repeated UTIs or backing up pressure directly into your kidneys. Research consistently shows that silent urinary retention is a leading cause of unexplained kidney dysfunction in older adults. If there is one thing you take from this video, let it be this action step. At your next medical visit, look your doctor in the eye and say, "I would like a quick post-void residual ultrasound to make sure my bladder is emptying fully." It is inexpensive, takes half a minute, and provides peace of mind that a simple urine cup can never give you. Before we move on to item number 6, let's take a quick pause. If this information is connecting the dots for you today and helping you understand your body better, please tap that like button below. It takes 1 second, but it tells the algorithm to show this video to thousands of other seniors who might be suffering in silence. And tell me in the comments, have you ever had a bladder ultrasound done right after peeing, or is this the first time you've heard of a PVR scan? That brings us to item number 6, recurring urinary tract infections after age 60. Many older women and men find themselves on round after round of antibiotics for UTIs that keep coming back every few months. While antibiotics clear the immediate bacteria, they do not fix the underlying reason why the bacteria set up camp in the first place. As estrogen levels drop in women after menopause, the tissues around the bladder and urethra become thinner and less resistant to healthy bacterial balance. In men, a prostate that prevents complete emptying creates that stagnant pool we just talked about. Citing studies from clinical urology literature, addressing local tissue health and bladder emptying reduces UTI recurrence far more effectively than continuous low-dose antibiotics alone. Your action step here, if you suffer from frequent UTIs, is to stop relying solely on repeated antibiotic prescriptions from urgent care. Ask your doctor for a referral to investigate the root cause, and if you are a postmenopausal woman, ask your doctor or gynecologist whether a low-dose topical vaginal estrogen cream might be safe and appropriate for you to restore natural tissue protection. Item number 7 on our roadmap involves common over-the-counter and prescription medications that secretly paralyze your bladder muscle. Hundreds of thousands of seniors take daily over-the-counter sleep aids, nighttime allergy pills containing diphenhydramine, older prescription anti-anxiety medications, or bladder spasm pills. Many of these medications fall into a class called anticholinergics. What these drugs do in the body is block the nerve signals that tell your bladder muscle to contract when it's time to pee. You take a pill to help you sleep or clear your sinuses, and by 2 in the morning, your bladder muscle is too relaxed to squeeze out urine, leaving you in silent retention or making you wake up 5 times to pass tiny trickles. Research from major geriatric health organizations advises caution with anticholinergic medications in older adults due to their effects on both bladder function and memory. Your action step this week is to gather every bottle on your nightstand and counter, including over-the-counter sleep remedies, and bring them to your pharmacist or doctor. Ask them plain and simple, are any of these medications relaxing my bladder or making it harder for me to empty? Never stop a prescription medication cold turkey on your own, but always have that critical conversation. To show you how all of this comes together in real life, let me tell you about a patient of mine named Arthur. Arthur is 72 years old, a retired civil engineer living near Sarasota, Florida. Arthur loves playing 18 holes of golf 3 times a week and taking long road trips to visit his grandkids in North Carolina. But over about a year, Arthur noticed he was scoping out every bathroom on the golf course. He was getting up 4 times a night, feeling exhausted during his morning drives, and noticed his urine stream was getting weaker. His regular doctor ran a standard dipstick urine test, said there was no infection, and told him it was just normal aging. Arthur accepted that until he developed a low, dull ache in his lower back and felt constantly bloated. When Arthur finally came into my office, we performed that simple 30-second post-void residual ultrasound right after he peed. Arthur thought his bladder was empty. The ultrasound revealed he was holding nearly 400 milliliters of urine behind, almost a full pint of fluid sitting in his bladder 24 hours a day. His bladder was so full that it was backing up pressure into his kidneys, causing that backache. We didn't do anything invasive or terrifying. We temporarily relieved the pressure, adjusted one medication he was taking for allergies that was worsening the retention, and put him on a daily prostate treatment that relaxed the bladder neck. Within 3 weeks, Arthur was sleeping through the night with only one wake-up. His energy returned, his backache vanished completely, and he just finished a 800-mile road trip to see his grandchildren without worrying once about where the next rest stop was. Arthur didn't have an incurable condition, he just had a common, fixable bladder problem that standard tests completely missed. So, what is your game plan starting tonight? Here is tonight's plan. 5 quick, concrete steps you can take starting right now. First, stop all fluids 2 hours before you put your head on the pillow tonight, especially coffee, alcohol, or nighttime teas. Second, perform double voiding when you use the bathroom before bed. Pee until you feel finished. Sit comfortably for another 30 seconds, lean slightly forward, and try to empty one more time. Third, pull out every over-the-counter sleep aid or allergy medication you take, and check if diphenhydramine is on the label. Fourth, start a 2-day notepad log of how many times you pee during the day and night to take to your doctor. Fifth, call your doctor's office or make a note for your next annual physical to specifically request a microscopic urinalysis and a 30-second post-void residual ultrasound scan. Now, while keeping your bladder fully emptied is crucial for preventing infections and kidney damage, there is another silent issue happening in the body after 60 that almost every senior mistakes for a bladder problem, but actually stems from your blood vessels while you are lying flat. In my very next video, I am going to reveal the gravity shift secret, a simple 10-minute afternoon leg habit that cuts nighttime bathroom trips in half without taking a single pill or changing your diet. I am Dr. Carl. Stay well, advocate for your health, and I will see you in the next video.